Okay, as we said, we are going to order the Prison Board of Inspectors meeting at 8:02 on Thursday, April 8th. We are going to allow now the opportunity for public comment for anybody who'd like to address the Prison Board at this time. Is there anybody who'd like to address the board? Okay, hearing none, we will take comment as we go throughout the agenda. We will look for a motion to approve the minutes from our meeting in March. Is there a motion to approve the March meeting minutes?
Motion to approve. Controller Moser.
It's been moved by Controller Moser and seconded by Commissioner Dersham. Any further discussion on the minutes from March? Hearing none, all in favor of approving the minutes do so by saying aye. Aye.
Aye.
The motion is carried. Okay, we're going to head into monthly reports and turn it over to the warden. Good morning, Chris.
All right. Good? Good. Why I'm not? Can't find my arrow. There it is. Good morning, everybody. Sorry about that, a little technical difficulty here this morning. Starting off with our returning citizen services report, we're looking at Center County Mental Health. Amy Miller continues to do call-ins. A year ago, she saw 45. This past year, she's called in and talked with 21. She referred 3 to Penn State Psych and 8 to Crossroads Mental Health Group. Dr. Wolf, they're doing virtual meetings. They've seen 12 returning citizens this past month. Crossroads virtual meetings, drug and alcohol is 1 male returning citizen 4 times per month, 1 female returning citizen 4 times per month, and mental health group 6 male returning citizens 4 times per month, and 2 female returning citizens 4 times per this past month. There we go. Center Compass program, right now it's been suspended, but it has end of last week it resumed getting people through. So right now we have no graduations for March. We will have some graduations for for April and May. That will be coming up. Work release community reentry workers, centerpiece has been suspended. Work release has been suspended. County maintenance requested 0 people, and grounds is 1 person that's been working. Our monthly reports continues with our population. Center County population as a snapshot on Wednesday, March 31st, 2021. Total of 136 is our total count for the whole populations in the county here. Center County population is 105, 13 females, 92 males. Unsentenced is 76. Of those 76 is 10 females and 66 males. County sentence is 17, 3 females, 14 males. State sentence is 12 males. Now out of that 12 males, we had 6 go up on Tuesday to SCI Smithfield. And then we have 2 more runs next week, as well as the following week or the last week of April. We have 2 more runs going out. Tennant County population, 31, 10 females, 21 males. Unsentenced is 19, 9 females, 10 males. County sentence is 9 males. State sentence is 3, 1 female, 2 males. As you see, our population started with Center County in the blue line was 115 beginning of the month, ended around 107. Tennant County is 32. We kind of ended with 31. I'll continue with our service report. Behavior modification status. We have 5 on Tier 0 and 13 out in general population. Our co-occurring disorder. A year ago, we had 22 with intakes of 99. This past March, 13 out of 45 intakes comes out to 28.89%. Only 6 were medications upon intake. Out of the 13, 11 came from Center County, 3 females, 8 males, 2 from out of county, 2 females, 0 males. Suicide watch a year ago was 10. This past March was 8. Out of the 8, 7 from Center, 2 females, 5 males, 1 from out of county, 1 male. Out of the 8 that were suicide watch, 1 was detoxing. That 1 was from Center County. It was a male. Detox total a year ago was 21, 15 from Center, 6 from out of county, 13 this past March, 3 females, 10 males. Out of those 13, 11 was from Center, 1 female, 10 males, and 2 from out of county, 2 females, 1 male. Substance detox by the numbers. Heroin was 6, 4 from Center, 2 from out of county, 1 from benzo was from Center, 0 in meth, 2 alcohol from Center, 4 multiple, 3 heroin alcohol, 3 from Center, and 1 heroin meth, 1 from Center. Our FIMAT, we currently have no new injections at this time. Going into our prime care report, inpatient hospitals, 1 for 2 days, 1 was detox seizures, heavy detoxing. COVID-19 test results for returning citizens, symptomatic testing pending is 0, negative is 264, 0 positive, and 75 recovered. Asymptomatic testing, 0 pending, negative was 283, 0 positive, and recovered was 48. Total seen by the physician and PA a year ago was 87. This past March was 56. Total medical transports of outside physicians. A year ago we had 5. This past March we had 20. Mental health clinician individuals seen a year ago was 216. This past March was 165. Psychiatrist was 80. This past March was 74. Mental health patients on psychotropic medications a year ago was 184, which was a 82.1% out of our ADP of 224. March of 2021, we have 87, 60% out of an ADP of 145. Daily average patient diagnosed with mental health is a total of 108 out of 145 ADP. A year ago, Category C was 118, 52.7%. Category D, 27, 12.1%. March of 2021, Category C was 87, which is 60% of our population. Category D is 18, 12.4% of our population. Our mental health stability rating, entire population, out of a total count of 136. Category A was 14 individuals, is 10% of our population. Category B is 17, 13% of our population. Category C is 87, 64% of our population. And Category D is 18 with 13% of our population. 0 is on placement waiting. Mental health stability rating by county, starting off with stability code A. The blue is Center County, the green is out of county. The blue, 12 males. Stability code A for out of county is 2 males. Stability code B, Center, 14 males, 1 female. Out of county is 3 males, 1 female. Stability code C, Center County is 68, 12 females, 56 males. Out of county is 19, 7 females, 12 males. Stability code D is 11, 0 females, 11 males. And out of county is 7, 2 females, 5 males. Going into our inmate grievances report, total grievance for March of 2021 was 14. That's the same number as a year ago, is 14. 3 were non-grievable. Non-grievable found at 0. Grievable was 5. Found it was 0, and there is no first appeal or second appeal. And 6 were refused for multiple reasons. Central Booking Center, total bookings for 2021 was 210. That's up 52 from a year ago. 11 to 7 was 74. 7 to 3 was 27. and 311 was 64. The picture shows that's the plaque that the commissioners got. Wilmer Andy Andrews, that retired, our central booking coordinator, had 34 years of service in. I have a couple more pictures here. It shows them there. We had a sign, Happy Retirement, holding the plaque from the commissioners. Up in the top right is a wooden plaque. The gray line means corrections. It's United States flag with his name, 34 years of correction, and CCF central booking. The two lower bottom ones is we did a virtual gathering with him, and it was really nice with the commissioners. We were able to give speech, and actually, I think they were pretty much entertained with Andy's family because they all got to join in as well. That's been in Georgia and all around the United States. They're all able to join into his retirement plan. So there. And that's it, sir.
Thank you, Warden. A great way to recap or to end off the recap of the monthly reports is with Andy's presentation. Again, for the members of the prison board who may not know and some of the public, Andy was, I mean, really, if any other correctional facility across the state, maybe the country, I don't know, but certainly the state were interested in building a new jail and wanted to add into their designs a central booking center, or they had a current jail and were looking at adding a central booking center, they would tour our facility and basically say, we want this, and we also want Andy if we can clone you. Obviously we didn't let that happen, but Andy was really a great member of the team, and again, that booking center was something he dedicated his career to, and so we're forever grateful for him and wish him all the best as we go forward. But just wanted to note that for the record for everybody. And we'll certainly miss him. But it was a great event. Thanks for putting that together at the facility. I know Andy was enjoyed himself on that day. So yeah. All right. Any questions from the prison board on any of the monthly reports? Any comments, feedback? Okay, hearing no questions there. Any members of the public wanted to ask any questions or feedback on the monthly reports? Okay, hearing none, we will proceed into our old business, and we're going to begin with update on data collection.
Thank you, sir. The data collection, as it's listed there, we have just a snapshot here from the other day of April 5th. This is, like I said, this is very in early stages. This is the beginning part of it with the stats of what we requested. The only part here is not the yearly accumulation of the data, which they're working on that, but they feel that's an easy part compared to this part here. The next 3 slides is all of our charges from our individuals in there. So they're trying to group that together, trying to make a data report out of that. We got to make sure our officers are reporting it correctly into the system so we're able to pull from it. So they got to make this, all this stuff, all the charges here and everything else into a format to be able to project out as numbers instead of just all this wording and charges and everything. So we're trying to condense all this down and so forth. So it's a work in progress, but we are making some small steps here. This is the most difficult part of the whole program, and that's why they're taking the most times. That's why they didn't worry about the other parts, because they feel that'll be easy, and they're trying to focus on this part here.
Okay, Warden, thank you for the update there. Looks good, and again, keep that last part does look like it'll be a challenge, but it looks like there will be a solution at some point. Any feedback on the data collection from any members of the prison board? Okay, any questions from members of the public? Okay, hearing none, we will proceed into our programming update.
Yeah, same programs we've been. I added Center Safe since we do use those individuals when we need to. Still continuing our phone calls and meetings, our Compass program in service. Visiting through the non-contact room continues the same. Video for our churches. And adding leadership program, which we're working with Centerpiece. We have a meeting on Tuesday about that. We're pretty excited about that. And also inside out program with PSU. So we're just learning about that one, but that's a new one we're working with. They've done that out in, I think, Pittsburgh University. They've done that with an SCI. It's working out really well. So PSU is looking to work one here at Center County for Inside Out program. Once we get more information, we'll be able to bring it to the board to talk more about it and so forth. We're looking at COVID, continue down through the correctional facility operations, COVID-19 future consideration with tentative county returning citizens. Since the last meeting, we opened everything up. Well, we didn't open everything up. We allowed females from Huntington County. Within the last month, we received 7 new commitments, which 5 are still remaining here. Our female capacity is very low. We have 19 in our B2 housing unit, which housed 56, so we have 37 empty beds. Our C units have 7 individuals in there with 30, with 23 empty beds, and we like to continue to open up the females as well as to other tentative county for males as well if it's possible. We've been getting some phone calls here and there from Huntington, from Lycoming, and Schuylkill. Schuylkill's having some difficulties with females. I think we have ample space for housing females and males right now. So I'm just open up to the board if they have any questions on me making that decision on taking what we can accommodate. I'm not saying we're going to fill up the jail. I'm just saying that we take so many that we make sure that we still have room and so forth.
Okay, thank you, Warden. Feedback from members of the prison board. We've talked about this before. We just wanted to check in to make sure folks were still comfortable with the warden and his team receiving Tennant County returning citizens from around the state. We're partners with many counties, but just wanted to check in, see if anybody had any questions, concerns, comments. Back.
I'm fine with it. I think it shows good cooperation between ourselves and our sister counties. So I would recommend we continue to provide the space available to other counties.
Thank you, Commissioner. Any other thoughts, feedback from the board?
I just want to say if the warden thinks we can begin safely bringing in new tenant inmates, I'm sure our fellow counties would appreciate the assistance.
Thank you, Commissioner. Any other members of the prison board? Okay. Yeah, I would also concur in terms of the amount of space that we have available. It's definitely there. We were able to have more at a certain point during the pandemic, but because certain counties have also reduced the populations at their facilities, they haven't necessarily given us some back, but we are in a position where we could really be helpful to them and do it in a safe, very safe way. And so great. Okay. Well, before we take a total consensus, we'll allow any other members or of the public to have any questions or feedback on this. I think I saw Janet. If you had a question.
Yes. Thank you so much, Commissioner Pipe. Warden Shaw, can you just remind us of the protocol? Now, previous to this, if you were taking somebody from, say, Huntington County, they were not in the jail. They were coming directly from the street because that way there wasn't any question about exposure. So what you're proposing now is different from that. You're actually proposing that we go back to pre-COVID ways of taking individual. I'm not clear on what the protocol is here.
So when Huntington had to shut down, and then when they reopened back up, we only took ones from the streets, from the police departments directly. Okay.
Right.
And then of course we had our little bump in the road and so forth. So we refused any other county bringing anybody in so we can maintain our facility and make sure it's clean and so forth. So what we're looking at is Huntington usually brings theirs from the street. Schuylkill, Lycoming, and the other facilities have theirs that are in quarantine currently. We require them to do a COVID test with them, and when they get here, they're going to be screened. Also, 14-day quarantine, and so forth. So they're still going to go through the quarantine protocols that we have in place here, no matter how long they've been at Schuylkill, Huntington, Lycoming, Union, Snyder, Clearfield, Mifflin, Franklin, whatever the counties we have with. if we need to open up and we have room now, we're not going to, like I said, max out. We're going to take so many that we can accommodate and make sure we get them through the quarantine process and go from there. But yeah, we're going to continue doing everything else with the protocol of COVID. I mean, they're going to come in, we're going to classify them, and then we're going to house them. We're going to make sure they go through the 14-day. CDC requires, even if you had a vaccine and you're coming into a congregated area as a correctional facility, they recommend 14 days quarantine. So we're still going to abide by the CDC protocols.
Thank you so much. And at the very beginning of this whole pandemic, there were problems having enough housing units for the quarantining, but you've now reserved an entire block of, am I correct about that, for quarantine? So that's not going to be an issue finding space.
Actually, with that housing unit is closed down due to the fact that we have everybody that's being quarantined is only a few right now, so they're in another housing unit that we have availability for. So once we start accepting other counties, we'll probably open that up and designate that as our quarantine unit currently.
Got it. Thank you.
Mm-hmm.
Thanks for the questions, Janet. Any other questions from members of the public? Okay. All right. So the consensus we're hearing is that there's a comfort level in having additional Kenny County returning citizens coming back in the facility, as we can be a help to other counties and monitoring that progress as we go forward. And just for historical purposes, the 31 or low 30s that you're currently at, Chris, as you know, but just for the public, that's the lowest it's been since, maybe 10 or over 10 years ago. And so just in terms of historical context, it's very low. So it does, like you said, it has created the opportunity to close down a unit for right now, but so we have that space available. So, all right, great, excellent. All right, we're going to then head into the COVID-19 vaccine discussion, and we'll have an update from the warden.
Thank you, sir. Looking at the COVID vaccines, we've been in communication, or Prime Care, or HSA has been in communication. They had to fill out paperwork. She's actually in the room here, so she can actually explain the process of how it works instead of me trying to repeat what she has to say, since she's at firsthand dealing with this. So I'm going to refer back to her with that.
Hello. So right now we are looking at getting vaccines for all of the facility, officers included from the Department of Health.
Are you off mute?
We're waiting on those to arrive. We ordered them last week. We were hoping to maybe get them this week. We have not received them yet. So what will happen is we'll have a 7-day window to give those vaccines. And then we will get the second dose, and if it's a Pfizer vaccine, 21 days. If it's the Moderna vaccine, 28 days. So we went through the entire facility. We asked everybody if they were interested in a vaccine. We obviously cannot make them get one. We had 63 returning citizens say that they would like the vaccine. I think I have about 14 staff members that still are interested in it that have not received it yet. So we ordered them. We ordered some extra just in case people change their mind. And then the process for returning citizens would be they would get the vaccine. If they were released during the period of time, we would offer them to come back and hold a clinic each week so that they could come back, get their second vaccine, and make sure that they received it, had their waiting period of 15 minutes, and then they could go. If it is somebody who would be going back to like a Prime Care facility that would be Schuylkill County, something like that, we could take the vaccines to Schuylkill County, since it's all under Prime Care Medical. Then they could get the vaccine a little bit closer to home.
I just can't go to another facility for like Mountain Indian.
Yeah, so the vaccines are available at other places. If they need to get their second vaccine, they could go to J.C. Blair. We cannot transport our vaccine, our second vaccine, to J.C. Blair, but that's not to say that they can't go somewhere else and actually receive another vaccine if they don't want to come back here. But we will have it available. We just can't transport that vaccine anywhere outside of another Prime Care facility at this time.
Okay. Okay. Thank you very much for that. We'll see if there's any other additional feedback, anything you wanted to talk about on that, Warden, before we took some questions from folks.
Thing we're looking at, I've been in conversation with some other facilities about the work release, their community reentry. Some of the wardens haven't even thought that far out yet about giving vaccines, or they're trying to get the vaccines there. What we're referring to is basically our work release and community reentry, making it a requirement for them to receive the shots, not mandating them, but it'd be a requirement if they want to go out in the community and work with Centerpiece as well as the work release. At a facility or at Burger King or at Paul Baker's, that we require them get a vaccines. Our biggest concerns, I think, as wardens, we look at it, the vaccines, we don't know when we're getting them, and that could be the problem. And when we do get them, we got to use them in a time period. So that's what we're all trying to work through and trying to figure out. There's several that agree that there should be some type of requirement for somebody to go out of the facility to work, and then when they return, so they're not carrying it, or make sure that they're vaccinated. So it's really a debate there which way you want to go with that. So I kind of present it to the board. We're working on that policy currently. So it's one of the things we're going to meet with Margaret today, talk a little bit more, maybe talk with Betsy, legal, and go from there. But I'm just seeing if the board wants me to continue to look at that avenue there.
Okay, thank you, Warden. So in terms of board's feedback on specifically not mandating it, but basically like a checkbox, and it's almost as if like what you're doing with currently. If we are only allowing certain, or prior to the pandemic, we would only allow certain. I'm sorry, say again. Did I freeze up?
You froze up, sir. I kind of missed what you had to say there.
No, you're good. Thank you. Thanks for letting me know. It's almost like what we did prior to the pandemic, where if an individual did want to go on work release, they had to have certain criteria met, where we just didn't let anybody out. So it's sort of just adding another checkbox to make sure that, number one, when they're going out to the community, they're safe, and then when they're coming back into the facility, as we know from the vaccines, from the research that's done, you're less likely to be able to transmit the vaccine, transmit the coronavirus if you have the vaccine, which is good for the safety of our facility. And it also helps, again, you said Centerpiece and small businesses. So that's the question kind of before us. How do we want to approach that? So any feedback from members of the prison board?
This is Jason. I think a requirement to go out to the work release makes sense. Again, not mandating it, but if they want to do work release, then they should agree to get the vaccine. Again, to protect both themselves, the other returning citizens when they come back, and then also employees and customers at Centerpiece and other locations.
Thank you, Mr. Controller. Any other feedback?
Yeah, hey, Mike Burney. We know with the vaccine that after the first shot, fear-related journals don't report infections after 7 to 10 days. We know after the second shot, it's extremely effective. So I don't know why we wouldn't reinstitute work release under those scenarios. I don't think there's a public health reason to do so. And then I guess that's all I have on that.
Thank you, Mr.
This is Sheriff. The Sheriff Sam, so I concur with the last two. I think they'll make it mandatory, but a requirement if they want work release, so bring it back and forth into the jail.
Thank you, Sheriff.
Yeah, I just want to add that I appreciate that you're doing everything you can to get people back to work release and entry. And on our end, we're trying to make sure the people who would interact with them the most are vaccinated, so that there's a double protection. Of course, everybody still wears masks. We still make sure that we're taking care of, following protocols that way. But I just want to say thank you, because I appreciate, the sooner we get them back, the better. So thank you.
Absolutely. Thank you, Kathy. Any other feedback from the prison board that hasn't been already shared? Any other questions or concerns on this? Okay. All right. So we have the consensus then, Warden. Let's implement that. And once we get the vaccines in house, I think you might have a line of people who might want to get out to work early. So hopefully that'll be helpful for them getting that vaccine. So that's great to hear. Great to hear people are interested in doing that. And then just a clarification in terms of the broader policy for vaccinations. Did we offer it to Tennant County folks or just Center County returning citizens?
We offered it to everybody in our facility.
Okay. Thank you. And then in terms of just out of curiosity, for the staff members who would be getting the shot, you mentioned there was maybe a dozen or so who were going to be getting that. Would that happen in-house at the correctional facility, I would assume?
Correct. Yes.
Okay.
But they're eligible in the community currently right now. We have a little over 30. Oh, we have 29. We have 29 currently fully in process or fully vaccinated now. Our correctional officers, they went on the outside and got time slots.
Oh, excellent. Okay, great. Okay. Okay, excellent. Any other questions in terms of vaccinations and the process on that? Sounds like we're go, please. Yes, please, Jan.
Quick question, Warden Shell. How many corrections officers and staff are employed altogether at CCCF?
Right now, we're down on some staff, so I'm saying we're probably right around 90.
So
105. Okay, 105 with medical.
So with 29 in process or fully vaccinated, plus 14 more are volunteering. Does that mean that all the others are saying that they're not interested in the vaccine right now?
They're currently not interested, but doesn't mean they won't change once we get it here. I think that'll change a lot of people's mind once we get it here in the facility.
I mean, it's somewhat concerning to me that the numbers are so imbalanced.
Well, and it's a good point to raise, Janet. And it's something that I think we were as the numbers were being listed off, we were doing kind of the mental math as well, thinking, okay, so recognizing that there is some work to do in terms of vaccine hesitancy, as they're calling it. However, one of the things I think you're going to see from at least I'll speak for myself is whether or not we can reduce or scale back some of the preventative measures that we put in place in terms of social distancing and the masking and other things that we put in place at the facility, extra cleaning. As we see that vaccination number increase amongst staff and somewhat returning citizens, that's still going to be a challenge just because of the influx and how that changes. But from the staff perspective, if we don't see that vaccine number increase, it's going to be difficult for us to roll back some of the protections that we've put in place. So as we see, again, Warden makes a great point. As we see more vaccines getting out there, I think the prison board is going to be, more likely to scale back some of those things. But yeah, it's something we're going to work on, absolutely. But as we know, we just got to get education out there. People want to be educated about the vaccine. I think we don't want to mandate it, but we have to, and the warden, if you want to talk a little bit about what you've been doing already at the facility, Chris, in terms of, educating staff in terms of the vaccine, that might just be helpful because again, that's going to lay the groundwork for as more people get the vaccine, more people will feel comfortable about it. People want to get educated. But if you could touch on that, because I don't know if we've talked about that before at a prison board meeting in terms of some of the education that's been done for staff.
We've been sending emails out. We've been talking to them personally. Medical has been a big advocate for it. Talking to the officers when they have questions. We tell them if they have any questions, come see us, come see medical. We've been sending out where places have vaccines that they get in the community. If they don't want to get it here, just the Bryce Jordan Center is opening up. We told them, right there, as well as the other facilities. So we've been doing and telling them, the administration here at the jail, Glenn, Mel, and I, we all received our vaccination and told them, we all had some minor things here and there on our seconds, but that's what we anticipated. So a lot of them, just like I said, they're just very cautious, and they're just waiting to see what other people say, I guess. And like I think once we get them in house, I think a lot of people will start changing their minds and so forth. But like I said, we can't mandate them currently, so we just really try to encourage them to get vaccination.
And I think, Janet, from the, last thing I'll say is I think there's, I agree with you. Personally, from my standpoint, I can't wait to get, sign up next Monday for the vaccine, or at least be able to schedule an appointment. But having the empathy for people who might not come from that same place, I think, is important. And so we haven't taken the position of, you've got to get the vaccine, and Chris and his team haven't necessarily said you got to get the vaccine, you got to do it. It's more about what questions can we answer for you, what kind of hesitancy might you have, and then go from there. And I think, from my perspective, I think that's a better way to get people on board with something, because it is a big decision for some to get that shot. So, so I think that's how we're going to approach it. But again, I think time will tell, and we'll see how it goes. But I hopefully that addresses some of your questions there on that point.
Thank you to both of you for the clarification.
Absolutely, sure. Any other final questions from members of the prison board or the public when it comes to vaccines at the facility?
I just want to say something real quick. If you guys have extra shots and need to give them out, let us know if we have anybody available who wants it in our office or something, that we make available to other county employees who may need shots as well. If you get your supply and you have to get rid of them those 7 days. So just let me know. We can talk offline about it.
Everybody, can you hear us, Commissioner Pipe? Okay,
Yes, we can hear you. Yep.
For some reason, we couldn't hear Brian, so.
Sheriff, do you mind just repeating yourself? Sorry.
No, I'm sorry. We're all home here, and my son's online, my daughter, so it's a lot of background. What I said is, if you guys have extra COVID shots when you get them and you have to use the doses, let our office know. If anybody available who needs one, I can send them up, or we can ask other county employees who would like to get one. That's if you're running, if you have extra and you need to get rid of them. So that's all I wanted to say. I appreciate it.
You're absolutely. We have you first on the list, and then we're going to open it up to the county, like probation and the caseworkers and so forth. If we have any, we're able to open it up to the county. So yes, we have considered that already. So.
All right, thank you, Warden. I appreciate it.
Sheriff, great comment. Thank you for that. And before we close out on this, thank you to Prime Care, the whole team there. Really appreciate it. We thank you for all the work. And again, great update today. It's good information on vaccines. So thank you for that. Appreciate it. Okay. We're going to head then into our next topic, which is, I want to think we're going back into policies. Okay, so we've got some reviewables or policies that were reviewed and then also revised. So we're going to talk about revisions and reviews. So back to you, Warden, and your team.
All right, thank you, sir. Going down to the first ones we're asking for approval is all the 100 general administrative policies that were reviewed. That means we reviewed them. There's no corrections, no additions or anything there. We just reviewed them, and what I'll do is we'll have a letter, and then once it's approved, I'll send it down to Commissioner Pipe for him to sign off, as well as myself for this. So starting off with 105 DNA testing, 106 county use of vehicles, 108 radio communications, 111 workplace harassment, 112 employees injury and illness, 115 staff searches, 117 shift trading, 118 employment selection, 19 registration of sex offenders, and 123 is electronic tablets, and 122 is inmate housing. Are all reviewed. No changes need to be done at this time. Move on to Do we want to vote on this, or do we want to continue through?
Yeah, if you wanted to continue through, we can then come back for any comments.
All right, sir. Going down to the approved revised Hunter General Administrative Policy. I didn't put any on the one here because there's very minimal changes that we did. That we changed some things just to make sure we're consistent with what we're doing. 101 tobacco, we had some grammatical and punctuation changes, and we added the footer down at the bottom of confidentiality statements. So that's all we did there for 101 for tobacco. But since we made some changes, we have to get it re-signed for that. The 102 public communications in section, actually I sent this out to the board so they have a copy of this if they want to follow through. 102 is a public communication, section A1, we just changed prison to correctional facility. A lot of our policies have correctional facilities, so we just want to refer back that we are a correctional facility, not a prison. And on section D, number 2, we made driver's license say also ID, because not everybody has a driver's license. They have a PA ID or from another state. So we want to make sure that change was there. 103, inmate funds and account. In definitions, the guilty of disciplinary committee, we changed to guilty as a result of a disciplinary procedures, just a grammatical area there, change there. Again, in section G1, we changed prison to facility. We removed a minimum of 15 plus for the cost of calls. It doesn't exist through GTL anymore. And what we did was we added in case section K, a new section 3, which reads, haircuts will be granted to indigent inmates. The fee for service will be placed into cost recovery on the inmate's account, which is collected as in section 1 of this policy. It just made that a little more clarified there for the inmates or the returning citizens, so they're aware of how it gets paid back, or if they continue indigent, how that works. 104, inmate transportation. The taser is called Taser Crew now, so we want to make sure that reflects what the new name is, Crew, throughout the policy. Instead of changing pregnant inmate, we just said pregnant female throughout the opposite. Change to pregnant inmate instead of pregnant female throughout the policy, made a consistency. Section G3C. Location of the second officers at the end of the sentence to location of the first officer. That was just misread. We just had to rewrite that, make sure it's more clarified. Instead of prisoner, we made sure we had inmate. And we added language, when transporting in a screen cage, unarmed officer will be positioned as the driver. Armed officers will be positioned in the front passenger seat. Inmate will be positioned behind the screen cage in the rear passenger seat of the vehicle directly behind the unarmed officer, and security restraints and restraints in the vehicle with the vehicle seat belt. When transporting in an unscreened or uncaged vehicle, the armed officers will be positioned as the driver. The unarmed officer will be positioned in the rear passenger seat directly behind the driver, behind the screen cage directly behind the armed officer. The inmate will be positioned behind the screen cage wearing authorized restraints, will be placed in the rear passenger seat of the vehicle opposite of the driver and secure using the seat belt of the vehicle. And then transporting a released individual, but not limited to, bus station, place of residence, or town of such, or any other location. The transporting officer or counselor will be positioned in the driver's seat. The released individual will be positioned behind the screen cage or unscreened cage vehicle opposite of the driver. This was in our training, but it was never in our policy. So what we did was just want to bring that and put that in our policy. So we made sure the officers understand, because when they went through the training, sometimes someone forget what they went through the training. So when we have it in the policy, they can always refer back to that. 107 is computers. We just made consistently change to IT contractor. And then we changed to shift commander to intermediate supervisors. 110 training, section D1 on page 2, we changed from redundant to recurring. 113 is a staff inmate relationship. We just made more on the clarification on definition with personal relationship added, which is outside of professional boundaries. We added new language about not sharing information from the facility system or any other information about other inmates or employees. We just want to make sure that it's explicit enough that they understand that. 114 is reporting off for work. We just changed that, make sure it's in accordance with the union contract. And we changed funeral to bereavement. 116, drug and alcohol work-free place. Fixed spacing in the bold of definitions, inappropriate behavior / under the influence and physical impairment. Minor, just a minor change there. 120 inmate telephone, change the duration of the telephone hours from 9:30 to 10 p.m. And we changed the RHU and segregation division receiving two phone calls because their first phone call was a 5-minute free call. And then they get a second call to make it one 15-minute call. So before we only allowed them one 15-minute call, but since we implemented GTL implemented one free call for everybody in the facility for 5 minutes, we felt that one phone call for 5 minutes is not enough with the 15 what they used to get. So we gave them a second phone call there for 15. 124 standards of conduct and work rule. Replace central book coordinator with central booking lieutenant. And added language to section 28, subsection 1020, providing personal information to the inmates about oneself, other staff, and other inmates. This includes, but not limited to, any and all information in the OMSE, and that's our offensive management system. That's what we use where we keep all the incarcerated individuals' information. One other one that we have here is the removal of 125 meals and meal reimbursement, petty cash. In our negotiation with contracts, we kind of got the petty cash removed, that we don't have to have a petty cashier for individuals going out to the hospital. So in the contract, since that was removed by both parties, we no longer need that policy.
Okay, thank you, Warden. So many policies there. Are there any that any members of the prison board wanted to ask any questions specifically about? And if we hear none, we're going to assume we're all good with them, and we can take action on them. And just one final pass on that. Any questions for any of those policies? Okay, hearing none. Any questions from any members of the press on any of these? Did I say press? If I said press, I apologize. It's just a habit that we. Oh boy. All right, members of the public. All righty. Hearing none, is there? We'll take one motion to approve the reviewals, revisions, or removals.
That's Controller Moser. Motion to approve the reviews, revisions, and removals of policy.
Commissioner Higgins, second.
It has been moved and seconded. Any final discussion on these? Hearing none, all in favor say aye. Aye.
Aye.
Aye.
Any opposed say nay. The motion is carried. Okay. Thank you again, Warden, for reviewing those. Appreciate it.
Thank you, sir. Continuing on, our Correctional Employment Week is coming up on May 2nd through the 8th of this year. We're doing our special meals again. I will be cooking half chickens. If the board, we will send an invitation out. I know Commissioner Higgins enjoys that meal. So we will have a drive up through. They can drive up and they can get their meal if they like to on that day. The half chicken barbecue and potato and whatever we have that day. I forget what's all on that menu there, but we're doing a little special meal every day that week. So starting on Sunday to Saturday, it's just our appreciation back to our correctional employees, from our officers to our counselors to our kitchen staff to our maintenance as well as to our medical staff. We just want to thank them for doing an excellent job through this very trying time. May we will be doing our employee of the year for each of the shifts and supervisors and so forth. So we'll be bringing that forward. I just want to let the board know that we do have a correction week coming up, and we will be presenting the proclamation, I think on April 27th to the Board of Commissioners. about that. But we will send out more information to the board about the special meals.
What was that date and time again, Chris?
I don't have the specific date for the barbecue chicken, but I will get that to you as soon as we set that date, sir.
Because it's like the best chicken ever.
Thank you.
No, absolutely. Thank you for highlighting that, Warden, and we look forward to celebrating that week, and it'll certainly be on our calendars. Excellent. Thank you. Okay. That looks like it'll conclude your portion of that. Anything else you needed to report, Warden?
No, sir.
Okay. All righty. All right. Heading into our additional monthly reports, we're going to turn it over to Carrie Hull from Criminal Justice Planning. Hi, Carrie. Good morning.
Good morning. Thank you. Just a brief update in regards to our drug overdose deaths. Just confirmed this week that we have 1 confirmed accidental overdose death, and we currently have 3 pending toxicology results. To give you perspective, last year in 2020, by April, we had 6 accidental overdose deaths and 2 overdose that were ruled suicide. So we are trending a little lower for this time of year compared to last year, which historically that's how it's been. We kind of go back and forth every other year. So that's all the update I have. If anyone has any questions.
Okay. Thank you very much, Carrie. Any questions or feedback on that for Carrie? Okay. All right. Thank you again. And we'll head over to the Prison Society. And Janet, anything you'd like to update us on today?
Yes, I have a couple of updates. Thank you for hearing my report. First of all, Connie sends her regrets. She never misses one of these meetings, but was unable to come today. The statewide Prison Society has contracted with the Vera Institute of Justice to do county snapshots. And so we now have a county snapshot for Center County, which gives some historical data. And I'm happy to share that. I'm assuming Commissioner Pipe and Warden Shaw that you received that, but if not, I'm happy to also share it with you. So one of the most interesting things about that county snapshot is that the number of unsentenced inmates percentage-wise increases significantly in 2012 and then stays high to the numbers that we have now in terms of percentages. And so it wasn't always this way, and I think that that's very helpful, at least for me, because we have been somewhat concerned, obviously, that the number of unsentenced inmates is so high. So that's one thing, and I will definitely get that to you. I wasn't sure if I needed to do that. The second thing is that the Prison Society is going to be participating in something called Justice Education Week, which is being put on by the Penn State Restorative Justice Institute. And I just put the link in the chat. But if you just type in Penn State and then type in Justice Education Week, it'll pop right up. And it's a series of presentations all week from April 19th until April 23rd that involve academic presentations, but also community groups. And so the Prison Society is doing a presentation on Thursday. Mark's Reentry Group is doing a presentation on Wednesday. Community conferencing with Centerpiece and Marie Hamilton. I don't mean to steal Kathy's thunder. I think is also doing a presentation, but maybe Kathy can say more about that. And the Freedom Fund, the one that's concerned about bail reform, they're doing a bit. So there's a lot of different things that are going on, and I think it's going to give us a snapshot of what people who are interested in criminal justice in the community, what does that look like? Who are we, and what are the groups, and what do we have to say, to each other? So I'm really looking forward to that, and I give a lot of appreciation to the Penn State folks for organizing something like this. And then also Warden Shell has promised to give me some information about the jail. So Warden, I'm giving you a little heads up that I'm going to be pinging you about that so that we can give an accurate presentation of the kinds of policies and practices. The title of our presentation is something like making visible what is hidden, or something like that, because the unique ability of the prison society to get inside jails and prisons, and so we can make that experience more real to members of the public who might not really understand how things work. So I'm appreciative of the warden, whoever it is that you get to funnel me some of the data, particularly about communication between how do people who are on the inside communicate with people who are on the outside. That's really important to us in terms of phone calls and visits and all that kind of stuff. So I think I'll stop there. Thank you. And I'm happy to answer any questions.
Thank you, Janet. And I think that the county snapshot would be a great thing to send out to us again. I might not have seen that yet, but yeah, we'd love to review that, take a look at it. That sounds interesting.
All right, thank you.
Yeah, absolutely. Okay, all right, and then we're going to move into last report for Centerpiece. And Kathy, thank you for joining us. We'll turn it over to you.
Yeah, thank you. Community conferencing is well underway. We have our training of our facilitators that will take place on the 16th and 17th. And we've had meetings with the warden and Lorinda Brown about the reentry component of community conferencing, which we're really excited about, and certainly appreciate the cooperation and the openness there. As the warden had mentioned, we have a meeting coming up next week to take the Leadership Center County course and kind of tweak it and rework it to see if we can work it for reentry to bring people back into the community, which I think will be very, very cool. I've reached out to the Prison Society. Very early talks about possibly beginning a support group for family members of incarcerated individuals. We don't have something like that right now. And just to see what the potential is of something like that. I know Centerpiece gets approached all the time by individuals who are looking for a support group. So I think it's something that there's a need for. We're beginning the change course, not we're, but Centerpiece with individuals from RJI and educators of Penn State. The change course is an entrepreneurial course that will begin, I believe right now, April 24th at the correctional facility. And yeah, Janet, thank you for talking about the Justice Education Week that's hosted and coordinated by Restorative Justice Initiative at Penn State. Community conferencing will be doing a presentation. It's the 21st at 6:15. So we're excited about going more in depth about community conferencing and also the reentry component of community conferencing. So I think lots going on. Thank you, though. I'm done.
Okay, thank you very much, Kathy, for the report. Looking forward to all the great things happening currently. Okay. It looks like we are at the point where we are looking for any announcements or adjournment, and we have no need for an executive session today, it looks like. So anything else, Warden, before we adjourn? Are you all good?
We are all good here, sir.
Okay, thank you, Warden. Is there a motion to adjourn at 9 a.m.?
Motion to adjourn.
Seconded.
Been moved by Controller Moser, seconded by Sheriff Hansel to adjourn. All those in favor of adjourning do so by saying aye. Aye?
Aye.
Aye.
We are adjourned. Thank you all. Have a great day.
Thank you. Have a great day.
Aye.